Hello everyone. We are from Group 1 and today we will be discussing about virus. So first, let me tell you about what is virus. So it is an infectious microorganism made up of a protein-coated segment of nucleic acid, either DNA or RNA. We all know that it can be found everywhere, maybe from the food, from the drinks, or from the things that we touched, or maybe from someone who is already experiencing symptoms. Virus can cause us pain, illness, and worse, death. Today, we will be discussing 12 types of viruses, its meaning, um, where it is commonly found, its symptoms, and its remedies. So, first, we have the norovirus. It belongs to the family of Saliciviridae. So, this type of virus is a very contagious virus that causes vomiting and diarrhea. So, people of all ages can get infected and get sick with this type of virus. This norovirus spreads so easily. It is commonly found in leafy greens such as lettuce and fresh fruits. So we should make sure that when we purchase leafy greens and fresh fruits, before we eat them, we must make sure that we wash them properly. This type of virus can cause gastroenteritis, which is an irritation of the stomach and intestines. The symptoms for norovirus are vomiting, diarrhea, and stomach cramping. So when we experience these types of symptoms, we must do these remedies. First is for any fever or discomfort, we must take paracetamol. Second is we must get a lot of sleep. And lastly, if you have dehydration symptoms, utilize specialized rehydration beverages which are sold in pharmacies like Gatorade.
So, hi, good morning everyone. My name is BJ Nicosha and I'm going to report or tackle a virus, especially to rabies virus. So, rabies virus has and significant to me because I was being infected of this virus. So, the scientific name of rabies virus is Lissa virus. So, Lissa virus is a neurotrophic virus that can causes rabies in human and animals. So this kind of virus is commonly found through animals such as dogs or cats, especially rabid animals such as dogs. So they are commonly carrier of this virus, especially as with also a rabies virus. So these are the thing if you had a rabies virus or the symptoms. Number one is nausea and vomiting. Nausea and vomiting is a foodborne illness. Also, um, headache, fever, confusion, abnormal behavior, hydrophobia, and hypertalization. So, these are the treatment of this virus or remedy. So if you are being bite or scratch of any rabid animal, you can go easily to wash your body parts that being bite or scratch. After that, you can seek a medical care. Thank you.
The next part is rotavirus. So what is rotavirus? A virus that causes diarrhea and other intestinal symptoms. In addition, the rotavirus disease is most common in infants and young children. However, older children and adults can also get sick from this rotavirus. The rotavirus is contagious that causes nausea and diarrhea. It is the leading cause of severe infectious diarrhea in children, and some babies and children may have diarrhea so severe that they may lose too much water, dehydration. Adults who get rotavirus disease tend to have milder symptoms. Next is rotavirus commonly found. The rotavirus can be picked up through objects like toys, hands, including food or soiled diapers, and is spread through hand-to-mouth contact in poop. If dili taga-wash sa to hands or practicing our hygiene, dili makuha ang mga viruses. The next one is, what type of food usually present? Any food that can be contaminated of food by infected food handlers due to poor hygienic practices. Like what I said kanina, nga if dili ta nagawash atong hands before using something na galing ta sa mga nagagunit ta sa mga like anything object without washing our hands, washing our hands or naga-practice atong hygiene, grado na makakuha ang mga viruses. Dili lang siya rotavirus, kundi any viruses. So the foodborne illness is the most common foodborne illness, and rotavirus is the severe diarrhea, vomiting, and abdominal pain. And the next one is the remedial illness of rotavirus is there is no specific medicine to treat rotavirus infections, but your doctor may recommend medicine to treat the symptoms. However, based on my research, there are two vaccinations that made in rotavirus. The first one is the Rotatec, and the next one is the Rotarex.
Good day, everyone. My name is Jean Albinares from Bachelor of Science in Tourism Management, and today I will be discussing about the hepatitis A. What is hepatitis A? Hepatitis A is an inflammation of the liver caused by hepatitis A virus. The virus is primarily spread when an infected and unvaccinated person ingests food or water that is contaminated with the feces of an infected person. So, unsa may causes aning hepatitis A? HIV is found in the stool and blood of people who are infected. Hepatitis A is very contagious. You can catch hepatitis A if you eat or drink food or water that has been contaminated by stools containing the hepatitis A virus. Unpeeled and uncooked fruits and vegetables, shellfish, ice, and water are common sources of the diseases. Another example is that kana ganing sa street foods nga kanang magbalik-balik og tuslo sa suka. Symptoms of hepatitis A: fever, malaise, loss of appetite, diarrhea, abdominal discomfort, dark-colored urine, and jaundice. No specific treatment exists for hepatitis A. That's all. Thank you.
So hi, in this part, we will talk about the coronavirus. And this is one of the picture of the virus, which is the coronavirus. The coronavirus has the specific name, which is the orthocoronavirus. And the coronavirus has a common name, which is the COVID-19. And the COVID-19 refers to the virus that causes it is as the COVID-19 virus. And the acronym of it, which is the code for corona, V for virus, D for disease, and 19 for the year the outbreak was first recognized late in 2019. Coronavirus are the wide group of viruses that cause disease in animals and humans. They frequently spread among cats, camels, and bats and may develop to infect humans. The viruses can cause ordinary colds and other minor respiratory infections in people, but they can also result in more serious conditions like pneumonia. It may also has cats, camels, and bats are common hosts, and they can eventually infect humans by eating it. A novel coronavirus named Severe Acute Respiratory Syndrome Coronavirus 2 or SARS Coronavirus 2, formerly known as 2019 nCoV, which was originally discovered during an outbreak of respiratory sickness caused in Wuhan City, Hubei Province, China. It's known as coronavirus disease 2019 or COVID-19. The WHO received its initial report on December 31, 2019. So what type of food it is usually present? It is like eating different exotic foods like bats, spiders, centipedes, and so on. It may lead them to get them the virus. So what is a foodborne illness it causes? It has salmonella and Campylobacter continue to be the most frequently reported illness. This drop was probably caused by public health initiatives meant to stop the spread of COVID-19. Orders to stay at home, bans on overseas travels, and other alternations of daily life could have effective exposure to foodborne germs. The ability to detect illnesses may have been hampered by other variables like modifications in healthcare seeking and habits. What are the remedy of illness it causes? Even if your symptoms are slight right now, speak with a healthcare physician immediately to see if you qualify for treatment. For treatment to be effective, it must be started as soon as symptoms appear. Additionally, WHO suggested a vaccination to help insulate us against the infection.
Hi, this is Trixie. Now, let's talk about the Marburg virus. A serious illness in humans caused by the Marburg virus is known as Marburg virus disease (MVD), formerly known as Marburg hemorrhagic fever or MARV. Despite the rarity of the Marburg virus disease, the Marburg hemorrhagic fever has the ability to spread in epidemics with high case fatality rates. Every Marburg hemorrhagic fever outbreak that has been documented has started in Africa. The illness, which belongs to the same viral family as Ebola, can cause hemorrhage, fever, and other symptoms as well. The World Health Organization states that there are no licensed vaccines or antiviral medication for Marburg's, but that early, skilled treatment of symptoms like dehydration significantly increases the likelihood of survival. The virus can spread between people by body fluids during unprotected sex, broken skin, or exposure to one type of fruit bat. After having direct touch with an infected animal or its bodily fluids, as well as through contaminated food products, people are susceptible to contracting the Marburg virus. Now, what are the foodborne illness causes? The illness causes are severe headache, high fever, diarrhea, stomach pain, and vomiting. Remedy of illness it causes is that The Marburg virus sickness does not have a particular therapy. It is important to use supportive hospital therapy, which includes managing the patient's fluid and electrolyte balance, preserving blood pressure and oxygen levels, restoring lost blood and clotting components, and treating any exacerbating infections. That is Marburg virus.
So these viral particles are usually detected in epithelial cells of the duodenum. So in order for you to know if you have this type of virus, you should watch out for these symptoms. The first one, we have fever, loss of appetite, nausea, vomiting, stomach ache, diarrhea, and of course, body aches. Astrovirus is a group of viruses that causes gastroenteritis or stomach flu. Infants and young children are most likely to develop symptoms including diarrhea, nausea, and upset stomach. Older adults and people with compromised immune systems are also at risk. So the remedy for illnesses it causes is the first one, we have the stay well hydrated. Replace lost fluids with water, broth, sports drinks, or unsweetened fruit juice. If your stomach is weak, try sipping a little at a time. Next is we have eat binding foods. So when we say binding foods, this includes the white rice, toast, bananas, saltine crackers, and applesauce. Avoid foods that can make your diarrhea worse, such as fatty foods, dairy, sweetened drinks, and caffeine. And the last one, we have take diarrhea medications. So this includes the over-the-counter drugs just like Imodium, Pepto-Bismol, or Cowpectate. And that is all for my presentation. Thank you. Okay, so hello everyone, a pleasant morning to all of you. By the way, let me introduce myself first. I am Kim J. Casanillo, and today I will be discussing to you the astrovirus. But before anything else, please excuse my voice because I am having a sore throat right now. Okay, so let us continue. So, the scientific name for astrovirus is Astroviridae, and it came from the family of Orthornavirae. Astroviruses are a type of virus that was first discovered in 1975 using electron microscopes following an outbreak of diarrhea in humans. In addition to humans, astroviruses have now been isolated from numerous mammalian animal species and from avian species such as ducks, chickens, and turkey poults. Astroviruses are transmitted by the fecal-oral route and can be transmitted through contaminated food and water, human to human, and through nosocomial infection.
Coxsackie virus. Coxsackie virus is a type of virus that belongs in the family of Picornaviridae. There are two main types of Coxsackie virus, type A and type B. Coxsackie viruses are responsible for a wide range of illnesses, including hand, foot, and mouth disease, and inflammation of the heart muscle. Coxsackie virus infections are most common in children, but they can affect people of all ages. The virus spreads through contact with an infected person's saliva, mucus, or feces, or by touching contaminated surfaces or objects. Symptoms of Coxsackie virus infection are very depending on the specific type of virus and the age and the overall health of the infected person. Common symptoms including fever, sore throat, headache, muscle ache, and rash or blisters on the hand, feet, or mouth. Most cases of Coxsackie virus are mild and resolve on their own without treatment. However, in rare cases, Coxsackie virus infections are cause more serious complications, such as viral meningitis, encephalitis, or heart problem. If you suspect that you or your child may have a Coxsackie virus infection, it's important to see a healthcare provider for evaluation and treatment. That's all.